Greetings and welcome to the Strengthening Health Commodity Supply Chains, a Healthy Systems Approach. My name is Jean Goodman, and I will be technical support for this webinar. Please note that all participants are muted and that the event will be recorded. If you want to change your audio connection, use the drop-down box for audio, which is to the right of the microphone icon at the bottom of your screen. You can choose Switch Audio if you want to connect your audio in a different way. You can also use the chat icon, which is located in the bottom right-hand corner of your screen if you want to submit questions or if you want to request support. We ask when you do submit questions to send them to everyone so that we can all see and respond to your terrific questions. With that, I'd like to turn things over to Alicia, who will take it from here.
Thanks, Jean, and welcome everyone to this webinar. Good morning and good afternoon, good evening, depending on where you are. My name is Alicia Beyer, and I'm a Senior Associate and Private Sector Specialist here at Abt. And it's really my great pleasure to welcome everyone today to what I think will be a very fascinating conversation that we're going to have with some industry specialists on health supply chains. Specifically today, we're going to be looking at opportunities to apply a health system strengthening lens to complex supply chain challenges. Before we get started, I think that it would be a good idea to get to know one another a little bit better and take advantage of this digital technology. And so we're going to pose a couple of questions to the audience using a polling tool to aggregate your responses. So if you're new to polling, it's fairly straightforward and intuitive, and I'm going to walk you through it. If you look at the lower right-hand corner of your screen, you'll see a chat icon. You're going to click on that icon on the bottom right of your screen, and the chat box will open. And then you'll click on the link for the poll inside of the chat box. You can access that inside the chat box. Another box will open and you'll see the two short questions. Remember, all of your responses are anonymous. And I'll just pause now for everyone to, for 30 seconds for everyone to take the poll. So again, the poll can be found in the chat box, and there's a link to the Mentimeter poll there. A couple more seconds for everyone to answer the two questions in the poll. When you're finished, you can exit the poll and return to the webinar. There's two ways to do this. You can click on the WebEx Event Browser tab, or if you've downloaded the WebEx app, just click on the blue and green WebEx icon that you see here on the slide at the bottom. Okay, so let's see how our results are shaping up. What's really nice about this is that results update as new people fill in the poll. So feel free to add your results as we move forward. So the first question is, pick the category that best represents the type of work you do: access to medicine, or other health functions, or other in general. It looks like so far we have 33 participants that have answered this question, and 14 of which have said other functions, and 9 access to medicines, and then we have about 10 generalists. So as we're working, I think that functions are, so some of these are supporting functions that are supporting this. Some of you are working in that general supply chain optimization, that core of supply chain, about a little less than half of you, and others of you are working in this general functions around the supply chain, like financing or health, human resource mobilization to strengthen that supply chain, the health system overall, as well as the supply chain. So I think that we'll be able to see the interesting interactions between those two and have an interesting conversation today about that. Let's see the next result from the second poll questions. Oh, there we go. Okay, so the question is, what are your priorities? What do you think are the priorities in building capacity of health supply chains? And so you can insert a word, and this is a word cloud. So it looks like we have our work cut out for us, and there's considerable breadth in responses here, lots of different responses. But we also have some interesting clusters like last mile, sustainability, quality, access, adaptability, and equity. I'm old, I have to look at this through my glasses here. So those are some interesting responses. I think we'll definitely touch on last mile, sustainability, quality, and this equity and sustainability and access. That's really the goal level of what we're trying to do with supply chains, is ensure equitable, sustainable access to health commodities. So we're in for a very interesting conversation. Thank you to all of you who participated in the poll. And I think we're all in the right place to learn and discuss more today. So our webinar today is going to be a talk show format, starting with a discussion amongst our panelists, and then we will open to the audience for Q&A. We encourage you to write in the chat box questions you have. As Jean mentioned, please submit the questions to everyone so we can all see your interesting questions, and feel free to submit questions at any time. So now I'd really like to introduce our moderator for today, and is Eric Redding. Eric is leading our discussion for today, and Eric is the Division Vice President for International Development at Abt Associates. And throughout his 25-year career in development, Eric has focused on the nexus between public and private sector. His work has included strengthening health systems, improving agricultural supply chains, improving business environment, and public sector services. Eric joined Abt last year, I think about a week before COVID. We shut down for COVID. So he had a whole week to spend in the Abt offices. And before that, he was the Executive Vice President at Convenes International, which managed the USAID Global Health Supply Chain Procurement and Supply Management Program. So without further ado, I turn it over to you, Eric.
Thanks, Alicia. And I'm very pleased to be here today and very pleased to have such a distinguished panel to give us some insight into the challenges and solutions that are out there in the world of global health supply chains today. I'd like to start by introducing the panelists, or giving a chance for them to introduce themselves. And I will pass it first to Tim Smith to introduce himself.
Hi, everybody. Tim Smith. I'm the Global Head of Aid and Relief at DHL. I have a commercial background through my freight forwarding background, but I also have spent several years working for the UN. So I consider myself a specialist, perhaps not an expert, but very happy to be contributing to this discussion.
And Azuka, if you could introduce yourself.
This is Azuka. I am the CEO for ARC Nigeria. My background is really in public health supply chain, but I specialize mostly in fostering PPP, so partnerships between government and private sector. That has been my strength over years, and some of the things that we have done in Nigeria will be what I'll be sharing here today. Thank you very much.
Great. And John, if you can introduce yourself.
Great. Hello, everyone. John Ferguson. I am an economist with the Economist Intelligence Unit. I've been with them for about 10 or 11 years, mainly focusing on things like trade, finance, and the global economy. But most recently, I'm now setting up a new practice within the Economist Group, focusing on globalization, trade, and finance. So these discussions about trade and supply chains are really fantastic and something that's taking up a lot of my time. So I'm really looking forward to the discussion.
Great. Thanks, John. And Bob, you want to introduce yourself?
Hi, everybody. My name is Bob Fryatt. I'm a public health and health system specialist, and I'm the project director for the USAID Local Health System Sustainability Project, which is the global flagship health system strengthening project. Nice to be talking to you.
Great. And thanks to all of you who've joined in the audience today. I see that our numbers continue to grow as people get logged in. We hope to have a very robust conversation, and the more questions you ask of our panelists, the more interesting and robust that conversation will be. So please do put your questions in the chat. We are not going to have prepared remarks from the panelists. We're really going to go straight into a question and a dialogue conversation. So please go ahead forth with your questions. In the meantime, I will start things off with a few questions to the panelists. I wonder if we can start with the question of what are the real opportunities and challenges for integrating the private sector into global health supply chains. I think that each of you have very different perspectives on that, and I'm curious to hear from all the panelists on this question. And perhaps we can start with Azuka on where you see those opportunities and challenges of integrating public and private sector into global health supply chains.
Thank you so much for that question. I get asked that question all the time by investors, mostly donors. With opportunities, I think we're all trying to solve the same problem, which is improve health outcomes. So if you look at in most public health systems, you know that there has been so much investment in the area of supply chain, and yet there remains major gaps when you look at health outcomes or the indices. In Nigeria, for instance, we see that maternal mortality rates are still very high. We see that under 5 months, still very high. Now, they don't have the system to. I think my network. I hope you can still hear me. So therein lies.
I think you've heard your video better. Yeah, we can hear you better now.
Okay, good. So the major case or the opportunity is that we still have the key health indices that speak to maternal and child health care very high. So with that in place, the government in most African countries are looking for collaboration to drive down those poor rates. Of course, the challenges remain that it's not always easy to foster collaboration. There's so many, I would even say, the lack of understanding of what supply chains are exists within the government. So you are telling someone that doesn't really understand supply chains to partner with you. A lot of times we have seen enforced partnerships which have not worked, whereby there are partnerships fostered outside the government entities, and then a private sector partner is then asked to go and support a government that does not give them the enabling environment to perform. So you see those partnerships not working. So now we have to go back to the key challenges. Are we speaking the same language? Does government understand what we mean by supply chains and where the gaps exist within the logistics system for them to say we are happy to have private sector collaborations in this area? So that will be the major challenge. We are not speaking the same language. Thank you very much.
Great, thanks, Azuka. Speaking of those differences in language, Tim, DHL is perhaps the largest freight company in the world and has an enormous footprint, particularly throughout Africa and the developing world. Can you talk about some of those challenges of doing business with government and how the differences in language between the public sector and the private sector can present challenges and some of the solutions that you found to overcome those?
Thanks, Eric. Yeah, I'd written down what Azuka said. Are we speaking the same language? Because I think that was a really key issue. What we find is that industry in general is very willing to assist governments and implementing agencies to do this kind of work. But where we struggle is in trying to understand what is required from us. And we think that the ministries and implementing agencies could do a better job of explaining their requirements of us and also providing the underlying data for previous years of work for us to figure out what assets and people we need to put to the task. There are cases, of course, where you can look to a particular country situation and find an industry match which might assist in strengthening systems for health programs. For example, two that spring to mind is the Kenyan flour market involves refrigerated trucks driving up north at the end of every day, at the beginning of every day, to collect flowers. But in theory, those trucks are actually traveling empty to collect the flowers and bring them back down to the airport. So there's a source of refrigerated transportation there. And also, when we were recently talking to a government body in Asia about the challenges of vaccine transportation, this particular country, which is not a big Asian country, was of the view that if you can get an ice cream in any part of their country, then they can get vaccines to any part of the country, which made perfect sense. The other issue is that the contracts themselves need to make sense. So quite often there is language in government and public sector contracts that we don't see in the commercial environment. And those are a great challenge to us because as a logistician and a supply chain specialist, we can really go for a piece of business that sounds great to us, but ultimately we need to present a contract to our legal office that makes sense to them. And that can actually kill the deal very quickly. I think that's all of my points. It boils down, in summary, I would say, to commercial viability. Everything we do for the governments and implementing partners needs to be commercially viable to us. Thank you.
Great, thanks, Tim. John, you sort of look at these things from a macroeconomic perspective. Can you comment a bit on, what the global trade environment around medicine and medical equipment is, and how the public sector and private sector supply chains may relate into that?
Yeah, thanks, Eric. I think there are opportunities post-COVID because now I'm seeing in my work, working a lot with multinationals around the world, I'm seeing a coming together of incentives or perspectives in the sense. I think the private sector players that I talk to are now really, really focused on resilience. And this is not just the health sector, but broadly the global trading system. And it's not just COVID that has led to this shift in perspective. If we went back 10 or 15 years ago, supply chains would have been about efficiency, cost efficiency, just-in-time manufacturing, etc. That is still partly true, I believe, but many firms that I'm speaking to around the world at the moment are starting to look at resilience themselves. And when I think about the health sector, the point of this panel is also about building resilience into health commodity supply chains. The opportunity that I see is that coming together, both of the private public sector wanting the same thing. Now, I'm sure there are challenges that Azuka and Tim have spoken about in language and contracts and that sort of thing, but I think that's a really important point. And when I think about engaging the private sector, if the public sector can understand that the private sector also has an incentive to be resilient to shocks, to avoid being susceptible to shocks in a certain country. If that stakeholder engagement and partnership can work well together, that's where I see the opportunity, where both sides want the same thing. It's just getting that partnership working well, I guess, is the challenge.
Great. Thanks, John. And Bob, all these pieces need to come together with the public sector and the private sector are providing a sustainable health system that allows for universal health care for everyone in the country. Can you comment on where you see these pieces coming together in terms of the health system and the way that this issue frames that way?
Yes, thanks, Eric. Yes, there are very interesting examples coming out, and when it comes to private sector engagement, there are sort of general lessons being learned, some of which have come out just a moment ago. I mean, you see enormous areas where there's opportunities to learn from the private sector, and something like barcoding, which I think has been pioneered, is now being taken on by a lot of public sector sort of side. We heard some nice examples around collaborations with the private sector, and that wonderful example of ice cream distributors and vaccines is one very nice example. But there are many, many others where simple collaborations, getting together and collaborating, you can actually get public health goals. The other ones are around like corporations working in rural parts of some developing countries can actually work quite closely on public health goals with the public sector. Some of the challenges, though, as it's touched on already, is around the contracts and actually having the capacity within government to understand what the private sector needs when it comes to contracts, but also when it comes to regulation. There's often very sort of limited capacity around regulations. The private sector is often ahead of the game when it comes to innovations, and creating regulations around that can be quite tricky. But the overall goals of all this that drives a lot of our health systems work is looking at delivering on equity problems where the people who both need services don't get them, delivering on quality problems where products have to be safe and services have to be safe, and then also goals around being efficient with our resources, because there's always going to be a shortage of resources when it comes to health, and actually being the best way of working with the private sector to actually optimize our resources is another key goal of our health systems work.
Great. We had a question come in on the chat about the digital traceability of medicines from the manufacturer through the national stores and the last mile to the consumer. And I wonder, I'm going to start with Tim and then go to Azuka to talk about some of the approaches and technologies that are emerging around traceability and supply chain systems, whether those are broader supply chain or the specific applicability to health and medicines. Tim, do you want to start with that question?
Yeah, that's a tough one for me, Eric. I can talk about it in general terms, but the kind of technology that's available to us in the developed economies can easily work in the developing countries with connectivity, and that's the major issue that we see in the supply chain for the low to middle income countries. So these devices, although they can be cost prohibitive at the top end of the scale, but these devices are usable as long as there's connectivity, and I believe there are significant advancements even in that area to come in the near future. But a general answer, but that's what I can contribute.
Great. Azuka, any examples to provide there from your work?
Well, I think one of the concerns with, I would say, technology within the public health system is who is funding it, who is the funder, who wants the data, what would they be doing with the data. Now, from what we've seen is that a lot of times there have been technologies that have been introduced, not by government, but by the donor agencies. And with that, the government, who we need to invest in supply chain, because a lot of times donor agencies invest in commodities. They want to invest in supply chains because there are no structures in place. Well, that is not really the ideal. The ideal is if we support with commodities. You put in place a structure to move the commodities to the places where they are required. So there is that need to have government ownership and investment in everything across board, end-to-end supply chain. But when the donors invest in the technology, most times the government do not make use of the data. And when they don't make use of the data, they don't invest in supply chain. So it's not that there are no technologies in place, it's more about how is this technology I would say, impacting the system, mostly around investing in supply chains that are sustainable. So one of the things we're doing now is, again, educating governments to understand the need to have visibility. COVID and the whole emergency response system really has brought that to the table with the investors in government. We worked with Lagos State government, and at the onset, they said, we want to see visibility. We're investing in the emergency response. So it was their investment. It was the Lagos State government. And at that point, we said, but you have a supply chain system, there is no visibility. And they were shocked, because they have been separated from making decisions in supply chain. And they didn't believe that there was no technology in place. And they said, well, in the agriculture system, we have technology. Why don't we have in the public health system? So again, is that one of the things we are advocating to investors to take a step back. Let's get government to understand the technology that is required and let them invest in it. So that would be my contribution. I hope it makes sense.
Great. Thanks, Azuka. So staying on the technology topic for a second, we had an audience question around the digital technology and how the COVID pandemic has stimulated the use of digital technologies for everything from the webinars that we're having today to digital health. I think there's a very interesting puzzle there in supply chain, because even though there's an uptake in digital health, at the end of the day, there's a medicine or a pharmaceutical or a device that may have to get to the consumer. I wonder if any of the panelists have a perspective on that move towards greater digital health and how it integrates with the very real supply chain challenges, which are very very specifically physical, and how those two movements together can come together. And I will start maybe to see if, Bob, do you have any comments on that particular movement towards digital health and supply chain? Or John, I just saw you move your camera on. Maybe you do?
Yeah, Eric, I can start, just share some thoughts from the private sector perspective. I think there will be a challenge with that last mile right to the consumer. But again, I'm seeing the private sector really moving towards complete digitalisation of their supply chain. And I mean, I can understand that's happening more with advanced economies and bigger multinationals, but I think that trend will filter. If we're here in 10 years' time talking about having another webinar, I would expect the vast majority of supply chains to be digitalised. I think that's a massive opportunity. Again, if we can have a partnership between the public and private sector, then what the private sector is really looking for is they want oversight across all different aspects of their supply chain. And it's about risk management and risk mitigation. And there'll be a lot more stress testing and scenario analysis and all that sort of thing, which I think is really positive. But as we get that data, and all of us involved in supply chains and have access to this data, that's where that sort of the government role becomes so important. If they can aggregate that data, see it across the multiple players in the system, and that they're sort of the gatekeepers in that sense. But I think this is a real positive, a real benefit for supply chains going forward, because again, everyone wants oversight, end-to-end oversight of their supply chains, and if we can make the most of that, I think that has to be a big part of making supply chains more resilient.
Great.
I don't know if I could. I wanted to add to that, because we have a good example in Nigeria, in a state, Yobe State. So this is a state that has had a lot of challenges with insurgency. So if you know about the Boko Haram, terrorist action. So there are so many health facilities cut off from the commodities that would have gotten to them. So this state, as a government, they recognize that they could understand the end-to-end need of the supply chain. So they knew they needed access to quality medicines because a lot of the companies that were, distributed left that region because of the security risk. So they didn't have access to quality health medicine, quality medicine. So they recognized they needed access to quality medicines, and not just that, they needed to have those medicines moved to all the health facilities, including those internally displaced regions. So with that in mind, they knew they needed private sector. So what we helped them do was to bring private sector that could partner with them for access. So the local manufacturers that drove down costs. So they had those companies supply directly to them. Now with those commodities in the warehouses, who would move it down? And they needed access to technology. So with that in place, they formed some collaboratives or partnerships with private sector companies that would distribute and also use technologies like drones. So the state government were looking at the outcome, having that understanding that we need to move commodities downstream, and we don't have the infrastructure, and they required private sector. So those, technology is not really the issue. It's that understanding that when we engage government strategically to look at what is required to get commodities to people that need it, then you see them begin to identify the pain points and say, okay, who would partner with us here? Who would collaborate? Where it becomes a problem in adopting things like technology or strategies is when someone else designs the supply chain for them and then comes to say, well, we have these private sector companies that will distribute for you. You will see that there will be a pushback, and it will look as if there is no opportunity for collaboration. So I just think it's a form of engagement that opens up so many opportunities. And this is just one state. And I can tell you for sure, they pay private sector, they are paying for the technologies, and all they want is really like what he said, the oversight. So just an example.
Great, thanks. Azuka, I think you previously spoke about the tension between investment in commodities and investment in the supply chain itself and the sophistication of that supply chain. And I think that's a very real tension that exists. And, several people called out as the key challenge, the last mile. It doesn't do any good to have a warehouse full of stores at the national or provincial level if there's a clinic level stock out. I wonder if any of the panelists have a comment on that tension between investing in the sophistication of the supply chain versus investing in a large amount of commodities to make sure that there is supply in the chain. But of course that causes a greater cost for the commodities because you have a lot of inventory being held and you don't necessarily have the commodity in the right place at the right time. And maybe we'll start with Tim on this one.
Rick, I think it boils down to visibility across several modes of transportation and in warehouses all over the continent of Africa and Latin America and other areas that need assistance. The systems that we use can take, when I say we, I'm talking about industry in general. The systems that are used in the supply chain industry can take data from very basic sources, can extract data from an Excel spreadsheet. That's no problem, but what's needed is that system infrastructure to actually see what you have in store. You're forecasting your consumption, and then you shouldn't need to oversupply as such, because by oversupplying, you're avoiding the risk of stockouts, but you also have the problem of goods deteriorating or expiring. So for me, it's not ambitious at all to expect to be able to see the stock that you have in any particular country at any point in time across however many warehouses, as long as the discipline is right and feeding into a system that can inform the buyers at the click of a button as to where they are, and also tracking the consumption, not just day by day, but knowing what will affect those consumption patterns, be it weather patterns or natural disasters or a particular time of year. I also just wanted to speak to the issue of digitalization in general. Shared a link in the chat, which is a good summary of logistics trend. It's a logistics trend radar that DHL puts in its insights section of our website, and talks about the various different trends that we're seeing in the short term, long term, and how they might affect supply chain. So it's an interesting read. It's not a DHL advertisement, it's an industry view.
Great. John, did you have a comment on that question?
Yeah, thanks, Eric. I just wanted to add, I agree with everything that's been said. I think what I've seen in sectors in public policy discussions and public policy research that we've been involved in, I completely understand when finance ministries have to focus on the here and now in terms of budgeting or health ministries and just making sure that things are okay in the here and now. But what I've seen work in other sectors around the world is when you can do this forecasting well, and when you can do stress testing well. Stress testing, I think, is a great initiative which has worked in the finance sector, for example, after the global financial crisis. But doing that work really well helps lift people's eyes into the future and can show them that actually, spending some money now to build capacity, build infrastructure, or whatever weaknesses you have in your system, spending more money now will actually save you money in 5 to 10 years' time. I know that can be hard because I totally get why here and now is important, and I've seen that work in other settings. And I think if we can continue to digitalise, get more data, get more information, that helps these sort of forecasting and stress testing initiatives, which might help to aid the argument about looking up and trying to plan for the future and spend for the future as well.
Great. And Bob, you spent a lot of attention on how to do that kind of capacity building locally. I wonder if you might talk to us a little bit about what are the right approaches for doing that sort of capacity building. And I see a question that's coming from the audience. Maybe you can work into that answer, which is talking about how the workforce strengthening and human resources for health within this element of supply chain can be integrated into that capacity building.
Very interesting points that have been raised. On related to supply chains and staffing, I think one thing I was going to say anyway is that one thing that we see is in many of the places that we're most concerned in, where the services are poor and the products aren't getting to where they should be, staffing generally is very, very, very limited. So we need innovations, and the private sector can be sometimes very good at this, that makes best use of what staff we have, or what whether it be sort of based in the community or in facilities or even in medical shops and such like that. But that involves actually very close engagement around like deregulation, allowing sort of pharmacists to have pharmacy assistants, or allowing nurses in facilities to do some pharmacy-like actions, so they can do stock checks with barcodings and such like. But this innovative use of very limited precious staff is a key aspect of actually strengthening in the last mile in the places where services are weak. On overall capacity building, I suppose at a sort of a larger scale, it's quite key that we focus on this together with the stakeholders on the ground in the places that we want to build that capacity. It has to be done in a collaborative way, whether it be in ministries or with pharmacists or with warehouse experts. They have to be engaged right from the start. That a collaborative approach is key, and co-creating solutions building up capacity is absolutely essential. And the other key fact about building up capacity is not just around individuals and their skills and experience, it's also around the organizations, the institutions they're in, having the right mandates, having the right sort of structures and financing systems, etc. And also the bigger system that we all work within. I mean, even supply chains, there's issues around workforce, around financing, are the right products being covered by the financing schemes, etc. So being aware that this is all within a larger health system that may have to have its capacity built up is also key. So it's individuals, institutions, and the broader system that the capacity has to develop.
Azuka, did you have anything to add to that overall question of capacity building and how to best achieve that? I know you've done a lot of work on that.
Well, I think I align with what everyone has said so far. Again, when we talk about capacity building, a lot has been done so far. I think I was in a meeting where with USAID, and they actually mentioned having spent almost $2 billion just focusing on capacity building across LMIC, which is a lot of money. So one would ask, why would we keep talking about capacity building? Where are those that we have strengthened? So I think, again, is what are we trying to achieve? Where are we going? What's the journey to self-sustenance in terms of supply chain? Where we're going is government investment, ownership, and government creating the enabling environment for partnerships with private sector and even academia. That is the need. So I think any capacity building initiative should look at that kind of strategic, leadership support, and that focuses on helping government set up the framework for integration, helping government set up the right governance mechanism wherein donors can co-invest. So for me, that's really the gap, quite strategic, so that governments make the right decisions. We should really limit capacity building initiatives that is addressing logistics gaps, inventory management, warehousing. I mean, for me, a lot has been done. Let governments invest in that if they have gaps in their warehouses, but more we focus on making decisions that matter. Thank you.
Great, thanks. And just a reminder to the audience, we've had questions from a handful of people, but there's more than 100 of you out there that haven't asked questions. So please put your questions in the chat and we'll pass them on to the participants. We've had a couple questions around the area of commitment and what I would describe as the political economy around supply chain. So let me bring a couple of those topics up and get comments from the panel on it. The first was that there's a strong need to enlighten the government gatekeepers to understand what supply chain is all about. This boils down to proper advocacy to decision makers. Once achieved, there will be good buy-in. The second question that's somewhat related to it is, we know about the importance of incentives and commitment on all levels of the value chain. A recent small anecdote I heard was in one particular country where there was a disincentive to digitize because print paper forms were a source of profit. Issues of incentives are also important in the workforce development. And how do we identify these types of barriers to healthy supply chains and address them? So getting in that question of, who is benefiting and the political economies of making changes that are good for the supply chain overall, but might break rice bowls along the way. I see, Azuka, you've turned your camera on, so I wonder if you want to lead that one off.
Well, I think coming from the first part of, advocacy, I've talked a lot about that. But I think one important thing we must recognize is that health is government must see health as a good platform for investment. Health must be a revenue-generating platform for any government. This whole aid, provide funds that will not yield returns, it doesn't work. One of the things we try to do is try to get government to see public health as an investment opportunity. Yes, it's not going to generate profits that goes out of the system, but it has to get returns. And with that, if government sees supply chain as a business, seriously, public health as business, they would invest. Again, is one of the things I do when I try to foster collaborations is that if the private sector will not get paid, there should be no collaboration. There are two different ways to leverage private sector. One is more about proceeds transfer. Yes, there are things government can learn from private sector, and if private sector can provide those kind of resources, pro bono, that's good. But I think one thing is certain is partnerships whereby governments, not donors, governments are willing to enter some good partnerships with private sector, whereby private sector are paid as at when due, and governments see the benefits. So I think those are the kind of advocacy drive we should pursue. Limit the advocacy for aid. I'm an advocate for government investment. Put money on the table. Not I'm investing my time. I don't know what that means. You have to put money on the table. I always tell government, how much are you going to put? And then I push for donor co-investment. So that drives it. And when government puts money on the table, they start looking for good partnerships, and they are going to pay for those partnerships. So that would be my advocacy drive if I'm giving that opportunity.
Bob, anything to add on that question of commitment and the political economy around supply chains, particularly as we try to get to more and more equitable access to medicines?
Yes, well, I think the political economy, the supply chains, as is so many other things, first of all, is to understand that, and I think that's something we constantly advocate for, is for the stakeholders involved in the policy making or championing their new innovations, understanding the political economy and where the decision makers are, the power is, where things may go wrong because people are pushing in the wrong directions. That all has to be better understood right at the outset, and as you implement change. The other thing is that things don't always go as you expect, and there's a path dependency. In one place, things may go really well. In another part of the country, it may go really badly. And so constantly learning, adapting is another aspect. And then sometimes there'll be unintended consequences, and you have to sort of re-look at what you were doing. So I think learning and adapting is another something that's key to sort of success.
Great, thanks. We have a question that kind of builds off of Tim's examples of the cut flowers and the ice cream, and it's that over the years, so many lower and middle income country public supply chains have been siloed by health area for various reasons. Not only siloed from commercial supply chains, but siloed into health areas of HIV and malaria and family planning and other commodities. How do the panelists see that siloing impacting the ability for greater private sector engagement in those national supply chains, and where might be those opportunities for improvement, whether they're like the backhaul example that Tim gave in cut flowers, or other areas where better integration of these public health supply chains with commercial supply chains might have opportunities. And I'll throw that to all four of the panelists, and somebody can turn their camera on there. You go, Tim.
Yeah. Thinking, I worked for World Food Programme for many years, and they always used to use the concept of a food basket. You would deliver the vegetable oil and the grain and the pulses to the population at the right time. And essentially, that's what you're doing with health supply chains. You're addressing the needs of a particular region, but those health needs are not just for malaria or HIV or reproductive health. So I think siloing, to some extent, helps the overall performance, because there are dedicated teams that can chase the objectives of a particular task order. But when it comes down to the country level stuff, I would suggest that siloing is not productive for private sector engagement, because we wouldn't want to, for example, be responding to 5 different teams to move 5 different commodities to one region of a particular country. So in that sense, I see it as counterproductive.
Azuka, do you have anything to add to that question around the siloing of supply chains?
No, nothing to add from my end. I think I just am okay with what has been shared so far.
Okay, great. So I wanted to turn the lens for a moment onto kind of the disruption that's happened in the world because of COVID, which has caused, a whole wide variety of disruptions, and, as I think John pointed out, has tested the resilience of the systems. But John, I'm going to throw this question to you first. What are some of the challenges to the overall kind of global supply chains and the world trading systems that has happened as a result of COVID that, we may be seeing the knock-on effects coming down the pike into the public health supply chain systems? I've heard, for example, that the deployment of containers around the world is at a place that may not be able to sustain the trading that we've had and other issues like that. Any of those macroeconomic disruptions we should be on the lookout for?
Yeah, absolutely, Eric. And I think you're absolutely right. Right now we're seeing a bit of a stretch, a bit of a strain on the containerization, the containers that transport all of our goods around the world. And that's going to affect prices. So therefore that affects how much people are paying to move their goods around the world, and that I can only imagine will have knock-on effects through every sector and the health sector as well. But I'll just draw a bigger picture too for the next 5 or 10 years, and this is why I'm of the view that supply chains are going to undergo a pretty significant shift in the next 10 years. It's not just COVID that are leading the private sector to make these changes or to consider these changes. So COVID's been a massive factor, of course. But in the global trading system, we've seen the US-China trade war, we had the Euro crisis, we had the global financial crisis 10, 12 years ago, and unfortunately, we are going to see more crises. I do a lot of work on climate change and the climate change impact on supply chains. We know from the work on climate change that there are going to be more frequent and more severe natural disasters, unfortunately. And they're indiscriminate. It could happen in an African country or a Latin American country. And again, all of that just makes all of this work so much more important. Understanding the vulnerability, having an end-to-end oversight of the entire supply chain. Because what I think all of that comes together, it just increases the costs. It just adds to the price pressures, again, on containers and trade overall, which makes getting these really important health commodities to consumers and the general public just even more difficult. So that's the sort of macro picture that I'm a little bit worried about, and why all these things that you're talking about are really, really critical.
Thanks. I want to take a moment to focus in on cold chain. Cold chain is something that was talked about previously in relation to medicine or in relation to agricultural goods and other things, but obviously with the COVID vaccine, the need for extremely resilient and extremely well-developed cold chains out to the very last mile has become a topic that everyone is talking about. Tim, I wonder if you might comment a little bit on what you see as the state of the cold chain infrastructure in lower middle income countries today, and what are the challenges and barriers that may need to be overcome to really get to a very, very wide distribution of vaccines that require extreme cold chain capabilities?
Yeah, sure, Eric. So there have been lots and lots of discussions day in, day out about the COVID vaccines, both on what we call the upstream, so the international piece of the transportation, getting it in with the aircraft, and then on the downstream, what needs to happen in the country. What some people tend to forget is that there are vaccination campaigns going on in these countries all the time. So there is a structure there, not necessarily a structure to handle the ultra-cold vaccines, so not a structure to handle the -70 vaccines that we see from one of the major manufacturers, but certainly those vaccines that travel in the 2 to 8 range. There is a structure which is now going to be super stretched because it has to reach much more of the population. But there are also many different mobile solutions that we can bring in, and any provider can bring in to satisfy that need, along with the fact that the challenge becomes greater when the population is not as dense as it might be in one country to another. So I think in every country there are different solutions that need to come into play, but ultimately what needs to happen to make this all work is to walk through 3 or 4 country examples of how we're going to get these campaigns done. And when I say 3 or 4 country examples, I'm talking about deal with Nigeria as a case. Look at Sierra Leone, which is a much smaller country with its own challenges. Look at DRC, which is unique. And as you walk through those country solutions, there will be different solutions in the countries, but the methodology you use to reach the solutions will be the same, and something we can learn from.
Thanks, Azuka. Did you want to add to that?
I think when it comes to COVID and I would say emergency response, there's something that can be leveraged. Right from the time of the Ebola, Africa worked as a continent and they came up with an emergency response strategy that was deployed across the continent, and every country adopted it and set up systems. And within every country, it kind of worked like clockwork. Every country adopted what the Africa Union put in place through the Africa CDC, and that was for emergency response. So when the COVID pandemic hit the ground, every country triggered that emergency response system. So there were like emergency operating centers, more like how you have in the military. But one thing they missed out was that they didn't factor in emergency response system for supply chain. All they figured out was that we need to have a stockpile. We need to procure. How those commodities, whether it's test kits, get down to the countries, they didn't factor that in. And of course, some of these initiatives are put in place by people that don't understand the importance of supply chain. So in Nigeria, for instance, they set up the emergency operating system, but they didn't know how to get commodity. They didn't know how to get people tested. They didn't know how to move, and they had to set up things like isolation centers, and they didn't know how to link them to warehouses. So one of the states, even in Nigeria, we have 37 countries, a state like Lagos State has 20 million people, bigger than a lot of countries in Africa. So one thing that we learned in Nigeria was that state, Lagos State, when COVID came into the country, even before they tested any person, they decided that they required a supply chain strategy for emergency response. They said, we need to know where to set up the isolation centers. We need to know which warehouses, how to set up emergency warehouses. We need to know how to move test kits to communities. So I think when it comes to things like COVID, even we should leverage. One of the things we're doing is speak to the Africa Union. Since we were able to deploy that strategy, and that was quite cost efficient. You were able to deploy that strategy, and every country adopted it. Why not institute within that same strategy a supply chain strategy within that, so that every country can have, streamline that process? So for me, it's simple. Once the strategy is in place, that strategy would have the warehousing strategy. It will have the inventory, so visibility is key. It will have that in place, and every country will adopt it, and we're good to go. So that will be my take in that.
Great. Thanks, Azuka. I'm going to bring us home here with one final question, and that question was, how do we manage transformations? And I'll add to that, how do we manage transformations in a way that is sustainable within the health system? As we're looking at all these changes we're talking about into the supply chains, what is the best way to go about approaching those transformations? And Bob, I'm going to ask this question to you and then close it out with Azuka at the end there.
Thanks. Well, for major transformations writ large, the sort of things we're talking about today, I think it's really key to make sure we're dealing with sort of powerful people and a well-informed public, and that we develop a sort of a common vision of where we're going to into the future. There's lots of fantastic innovations that we see, but if there isn't a commitment to actually see it through and understand where that's going to in the longer term by the people that matter, then often those opportunities are missed or delayed. And then obviously what we talked about today, having the capacity to deliver on it is actually key.
Thanks. Azuka, anything to add to that?
I think when you talk about sustaining the innovations and transformations, I always go with having platforms. So I would say if you have countries where you know you need to foster collaborations, you need to have a kind of platform that gathers or has a network of private sector companies that you educate, you know, as a group so they understand the public health system. And you get them to pre-commit, you get them to be engaged. Because one key issue with scaling innovation is the time it takes to foster any partnership. We lose a lot of mileage when you need to get, just for one collaboration, it can take months. That can happen when you are trying to do transform a system in Africa. For instance, there will be so many touch points for collaboration just to lead to transformation. You're looking at the warehouses, you're looking at the last mile delivery, so many different partnerships that you need to foster. You cannot spend 1 month to foster one collaboration. So we need to foster platforms, you know, set up platforms, gather private sector together, educate them together, bring them up to speak together, get them pre-committed so that you can trigger, you know, the key to transformation is responsiveness. The time you take to foster one collaboration and move things forward, the faster you can get a system transformed. So responsiveness is key. Thank you.
Great. Thank you very much. Well, I want to take an opportunity to thank all of our participants or all of our audience members today. We really appreciate you joining us, and please join me in giving a hand to all 4 of our panelists, Tim, John, Bob, Azuka. Thank you very much. I learned a lot from this, and I hope everybody else did too. Have a great